This podcast has been brought to you by GM Moving, part of Greater Sports. We're here to help the people of Greater Manchester get moving and to improve lives through physical activity.
Welcome back. I'm Eve Holt, Strategic Director at GM Moving, and today I'm having a conversation with Tim Emery from the Town and Country Planning Association all around active, healthy places. So we'll be thinking about what does this mean in a time of COVID, and what are some of the changes we'd like to see made in the future to help people and communities thrive.
Yep, so my name is Tim. I'm a policy officer at the Town and Country Planning Association. The TCPA, it campaigns for reform in the planning system in the UK, trying to make it more appropriate for people's needs and aspirations. And my particular role, I focus on healthy placemaking and how we can create environments that are healthier, so people can make healthier choices. A lot of that involves working with local authorities and planning teams, trying to get them to talk to each other and talk to different teams in the council, but also outside, because it's a collective effort. Can't do it by ourselves. So yeah.
So healthy placemaking, certainly placemaking feels like it's become a real sort of buzzword over the last few years, and a far greater focus on place, which I think is right for so many reasons. So can you, I guess, explain for the sake of any listeners who aren't familiar with what we mean by placemaking, and then what we mean by healthy placemaking, and what this has to do with your job and then with GM Moving?
Yeah, I mean, a lot of planners hate the word placemaking. That's kind of like, what does that actually mean? And it can be a bit vague. I think it's a great term. It's thinking broader. It's the wider picture. Place, we don't live in boxes, we live in places and communities. So it's having that wider idea of what's important in a place that is high quality, well designed. But yeah, in terms of healthier placemaking, that's focusing on how we incorporate aspects of the environment where people can make healthier choices. So having green spaces, green infrastructure, having cycling and walking infrastructure in place, because if we don't have these things in our environment, we can't lead healthier lives, basically. So it's shifting our idea from thinking about just delivering houses to delivering places that people can lead healthier lives, which is key right now.
So thinking about us not being in boxes or bubbles, there's definitely a real sense at the minute that we've been told to stay in boxes and in bubbles, which brings certain challenges in terms of what environment we actually get to interact with. And within that, it feels all the more important that you have within your close proximity access to green spaces, spaces that you can safely, whilst distancing, enjoy a walk, enjoy a cycle ride, enjoy a run, enjoy your daily dose of exercise. And I know that for me, living in Whalley Range, the local park has been an absolute, godsend in terms of us as a family with 3 kids, that there is somewhere that is open, that is spacious, that, in terms of physical and mental health has been huge. Not everybody has access to that. So what, I guess, are some of the particular challenges that you're currently seeing in terms of COVID, but also some of the opportunities?
Yeah, so a big sort of buzzword that everyone's talking about at the moment is health inequalities, and that's a big agenda to push forward from this as well, because not everyone has access to green spaces, walking routes, cycling routes. It's put a spotlight on health as an issue, which is quite sad because we should have been thinking about this before coronavirus, but now it is affecting everyone. So it's suddenly become an issue that we're all talking about now. Is there is such inequality in society, and planning can have a really key role in helping to address that. So that's from this. If there's any positives that will come out of this, it is trying to ensure that everyone has equal access to services and facilities, because not everyone does.
So that reality at the minute of some people's lives, if you don't have space inside, if you don't have a garden, if you don't have safe access to space outside, certainly has a big impact on whether people can currently stay active, and what options they have to them, but has also, as a flip side, as you say, has also highlighted those inequalities that, you know, we knew were there, been campaigning to try and shift, but maybe wasn't on everybody's kind of consciousness. So hopefully something that we can, you know, now it's on people's radar and on the agenda, look at how we change. So how do you, in making some of those changes, what sort of things can we influence? What sort of things do you look for and look to in that influencing process?
So again, big thing in planning is to make people talk to each other and making teams come together. A lot of the work that the TCPA have done in the past is bringing public health officials and town planners together in the same room, even just to chat and get to know each other, because public health officials they're often in at county level, so they're not necessarily in the same office. So there's that physical distance barrier. So bringing people together, and creating a shared evidence base and developing shared strategies to move forward. Because if we're not on the same page, then we're not going to get the same outcomes, and we're not going to achieve the same goals. So it's quite a simple thing of just bringing people together, but it is very effective. So in terms of planning for healthier places, it is bringing the key people together, and it's not just town planners and public health officials. It's councillors, it's transport planners, it's the community as well, services that deliver leisure. It's bringing everyone around the same table to get everyone talking about it, and hopefully, from this, that will definitely happen more.
And that feels like the very clear opportunity within Greater Manchester. So I think with devolution, with our regional mayor, with the work we've been doing across health and social care, there's a real sense of shift from quite siloed working, from people in their boxes professionally, to really bringing people together, and certainly bringing people together around an agenda of health, and bringing people together around an agenda around place and place making and what that means for people's health, and then a real focus on those kind of, you know, quite sometimes difficult conversations actually around the inequities within all of that and the impact that has. So that feels like something that is in our gift in Greater Manchester, that we've made huge progress across that ecosystem over the last few years, and that's a real need now to really build on that in terms of what that means for active design, and ensuring that, you know, planning is often feels like quite long, sometimes quite slow part of the process. So you have to start early, don't you? You have to bring those people together at an early stage, and involving, as you said, the community and residents. And for all the reasons we've just said, when people have very different perspectives and experiences, the importance there of all the work we're doing around kind of that being a co-design, co-productive process in which you have those different people around the table to say, actually, will this work for me? Does this fit with my day-to-day, with where I want to go, what my working hours are like, what my caring responsibilities are like. So how, I guess it feels at the minute that there's this opportunity where this spotlight is on place, is on health inequalities, and there's this need to bring people together to kind of this reimagining and redesign of the future. but it's quite hard, isn't it, for people to see ahead at the minute, because we're all sort of also in this sort of crisis
True.
state. So how in terms of your work at the minute, how are you getting this balance between, I guess, being caught up in the current crisis and reality of that, but also being able to have an eye on the future?
I think it's hopeful to think that this is not going to last forever, like there is light at the end of the tunnel, but for now it is still keeping in contact with everyone, making those connections. A big part of our work is going physically to local authorities to help them with their problems, which is something we can't do that, but we can do that remotely, and that's a really exciting opportunity that we haven't done before at the TCPA. But I mean, it's tricky. It is, and everyone's been affected by it differently as well, and not everyone's in the same circumstance. So moving projects forward, you're having to adjust timescales, because I mean it's difficult also for others, and so
So that in that move online, which so many of us have had to make, and that, so we've seen that can open up opportunities for engagement and connecting people across different places, and I know that in Greater Manchester, so we're adopting sort of Commonplace, which is a website that we've been using across a number of spaces in Greater Manchester, so the Levenshulme bee lines, for example. It was used with Andy Burnham actually for his sort of manifesto. Obviously that's now coming to an end as the elections are postponed. It's been used in a number of spaces where particularly they're focusing on the walking and cycling, and they're now adopting it across Greater Manchester as part of COVID, in terms of trying to engage and consult around people's current travel options. So it's a good example of where an opportunity has arisen. Commonplace have generously gifted it for this moment in their kind of contribution to the response, but hopefully will enable us to capture a whole load of information at this time, which will be invaluable as we kind of understand what people's thoughts are in terms of the future. Are there any other, so that's kind of one opportunity that's come out of both what we're doing and how we're doing it. Are there any other particular opportunities or things that you've seen spring up in the last few weeks?
I think there's a lot of studies, early stages of studies, looking at how the virus affects people differently. And we know that if you're over 70, you're supposed to stay inside. But also if you're underlying health issues, so diabetes, severely overweight, you've got a higher risk of developing severe symptoms. So the future studies that will look at this and look back and see and highlight how we need to address these, how we can improve people's health in the end, and how we can do that through the planning system to allow people to lead healthier lives. It's all about resilience, isn't it? It's trying to increase our body's resilience for some stuff like this in the future. And coronavirus, it can affect anyone, of course, but it's trying to ensure that you are as healthy as you can be, is key. So that will be interesting to find out what comes out of that. But also another big thing is air pollution. If we look at all the cities around the world that have cut their private vehicle use, air pollution is dropping massively. And Public Health England, before coronavirus, air pollution was one of the highest environmental risks to human health. So it is, who knows what government will do in terms of transport after this, but the fact that we're not automatically getting in our cars now, we are choosing to walk and cycle, is a great opportunity. And I think that is something that we can build momentum definitely. And I mean, here in Brighton, we've closed a road. I'm sure in Manchester you're going to be closing roads as well, and hopefully that happens more.
So have you seen in Brighton, because I saw that over the weekend, I was reading actually about what you've been doing, have you seen the impact of that so far? I know it's early days.
I know on the seafront people are walking and cycling a lot, which is great, but in terms of social distancing as well, it's that balancing act. We also have a bike share scheme, I'm sure you do in Manchester as well, and if you think if people aren't washing their hands properly, that's if you think about that, that's another way to sort of spread the virus around the city. But in terms of closing the roads, yeah, it's road along the seafront, Madeira Drive, and it's popular anyway, and I'm sure it's getting a lot of use as well. But it's quite a wide road, which is good, so people can keep that 2 meter distance. And if you think about how roads and streets are designed generally, a lot of pavements are tiny, and if we're to keep 2 meter distance on a tiny little pavement, you just can't do it. Yeah. So that's that aspect as well. Looking to the future, the way we design our streets, making them for pedestrians and not cars and cyclists, there's that aspect as well. So,
and that's definitely a very live debate at the minute, certainly on social media, but also had various conversations with likes of Transport for Greater Manchester, with our Health Social Care Partnership, with our police, with Chris Boardman as our Walking Cycling Commissioner, and with Andy Burnham as our Mayor. We've been having this conversation around what are the current opportunities, but also, the challenges and all of that, at a point that councils are obviously absolutely on their knees in terms of the demand for them at this time. So trying to get that balance right between different people's needs, different people's perspectives, encouraging people to have their daily dose of exercise, but also making sure that they are staying safe, they're only going out for essential journeys and for their daily dose, and they're keeping distance. There's a huge amount, really, isn't there, in that complexity to kind of juggle. And I know that, trying to get a sense from other people about what their experiences are, because it looks very different in different parts just of Manchester, never mind Greater Manchester. So, I know that I go out, daily for my run or walk or ride, and I'm skipping onto the road regularly in order to avoid being within less than 2 meters away from other people. When I'm out doing that by myself, I feel quite comfortable about that, but when I'm out with my 3 kids, that feels quite different.
Exactly.
The open roads it's phenomenal, the difference. I live fairly centrally to the middle of Manchester. Air pollution levels are high. I ride my bike every day. I feel it day to day. I feel that sense of grime, and now I go outside, and it helps that we've got this beautiful spring weather, but the level of peace, the level of calm, I feel so much calmer out on the streets than I do normally. I am seeing different people. I'm seeing far more, I would say, mums with smaller kids just going around the block with kids on bikes. I have seen people of different ages, different backgrounds, who are clearly out doing their sort of daily dose, just going around the block to get some fresh air, and the park. And I'd say people have been, my experience, they've been following the guidance. They're just clearly out for a bit, but it can get quite busy. So but that looks very different in different places, as to who's out and about. So first of all, do you know what the decision-making process was in Brighton for that example? Do you know what led to closing the road?
I think there's a combination of different campaign groups and charities. I know Sustrans and a few others wrote a letter to the government, I think it was last week or this week, I can't remember, asking them to make it easier for councils around the country to deregulate closing roads, because usually it takes ages, lots of red tape. But I think that might have sparked Brighton to quickly do it. I don't know, they might have been planning to do it already, but
there's been lots of examples around the world, haven't there, that I've seen, and then so Brighton and a few places in London now have done the same. And I was reading about the deregulation and the changes there. And in terms of kind of the longer term, so we've been looking at our local plans in Greater Manchester and the Greater Manchester Spatial Framework. Where do you go to? What are you looking for in terms of the opportunities in these processes to influence and create this healthy placemaking? What are you looking for in terms of when those opportunities are there, and then what are you looking for in those sort of documents, in that policy sort of process?
Well, like you said earlier, planning, the process is so long. It's a very long process to get local plans adopted. So the earlier you can sort of get in to that process and be involved, the better. The further down the line, it's a lot difficult. There's still opportunities, but if you're at the table to start with, that's great. So in terms of pushing the health and wellbeing agenda, to even make the planners in that team aware of it, it's all about policy hooks as well. So every local authority should be working on a local plan, and if there aren't hooks for policy officers and developers to use in those documents, it doesn't come up, it doesn't flag up. So if there aren't health and wellbeing policies in plans, it's not going to be considered, really. You need those policies in place to deliver the places that you want on the ground. And if you have good policies in the plan, developers can see that and recognise that that's what you as a council want to achieve and deliver. And at the end of the day, developers want to create good places for people to live. They don't want to build rubbish places.
So have you got examples of what does a good hook look like?
Yeah. So TPA, we've done lots of different projects over the years. A big project that we were involved with last year was putting health into place, and that looked at sort of pulled together the NHS Healthy New Towns work, and so that group of resources is invaluable for people to see how different local authorities are achieving healthier places. But in terms of like individual policies, that's something that we're trying to build a good sort of case study examples, so we can go to local authorities and show them and say, hey, this place has achieved this, you should look at what they've done, and you can do the same. But yeah, it's showing people examples as well is really useful, because if you've got nothing to compare it to, so it's sharing knowledge and different experiences is key.
And that feels really valuable in terms of in Greater Manchester, how obviously we can share knowledge and examples across the different districts, as people are learning and planning teams working together with their colleagues to create really active environments, but also then much further afield with the likes of yourself, and really go, what are those what is that best practice, what does it look like out there, and how can we openly magpie, really, because ultimately we don't want to just be the most active place as Greater Manchester. We want to support people across the nation to be active and well, and to flourish and be connected, and that creates that absolute resilience that you talked about at the beginning, doesn't it, really, where we can all get around and access the services and stay fit and well at the same time. Which links, ties into so many other agendas. So whether that is on health and tackling obesity and other sort of and lifelong, underlying health conditions, we're really noticing obviously the impact at the minute on those with respiratory challenges, and COVID obviously that presents a real problem for them. And then the flip side, people really appreciating the kind of cleaner air quality at the minute, and that enabling them to enjoy being outside differently, as well as then obviously the environmental agenda, which I would hope to see in local plans far more hooks from a climate change, reducing emissions perspective, which all naturally lend themselves, don't they, to building healthy places, healthy people.
And that's the thing, it's everything. If you think about it, everything's interlinked, and it's breaking down that silo mentality, in terms of working with people, but also the actual topics. So climate change, green infrastructure, health and wellbeing, sustainable transport. You'll usually find specific policies and local plans on those specific issues, but it's interlinking them, because they all help and contribute to each other. So it's finding ways of trying to achieve the same goal with all these policies, because they at the end of the day, they're all really important, and they share the same common agenda of creating better places for us to live. So
absolutely. So that's shared, really on recognizing our shared vision and how we all get there together.
Exactly.
And have there been, so again thinking about some of the local plans, and I've seen some of the kind of initial responses to those in some districts, and suggestions like making sure that suggestions that as a right, people should have access to green space within a 5-minute walk of their house. There's obviously been this quite live debate over the last year around creating 10-minute or 15-minute or 20-minute cities. So Paris have got theirs. There's been conversations in other localities across Greater Manchester, really highlighting some of that is just how you can get from across often a city centre within 20 minutes by foot or by bike. And sometimes it's just a case of mindset, isn't it? And that hasn't been made clear to people. It hasn't been made easy for people. So they don't think about it as a place that they can access in that way. And sometimes simple signage, sometimes, whether it's technical apps, stories, things that just help demonstrate for people that actually this isn't a big distance. And I think a really powerful example I saw was where they'd overlaid the Trafford Centre over Altrincham District Centre and highlighted the distances, so people are very happy without questioning it to walk from their car to the Trafford Centre to the shops. And actually when they overlaid that over a district centre, it demonstrated that similar distances really, and yet people would not consider walking it. It's just completely this perception. So are there any particular things that you've been drawn to that you've seen and thought, oh, they're nice concepts, or that maybe we should be looking out for and expecting to hear more of in terms of these particular ideas of what should be?
I think that's really key, is changing people's attitudes, because it's so easy to think, oh, I'll just pop down to the shops, I'll just hop in my car kind of thing. And it's changing that. It is changing that mentality in people's attitudes, because some people don't think they don't feel safe enough to walk down the street necessarily to the supermarket. But I think the idea of walkability is something that really interests me, and it's a hot topic in America. And the idea of that you've got these 5 sort of variables. If you think about density, distance to services and facilities, the design of the street, it's the combination of different variables that will help and encourage people to walk and cycle. If we create compact neighborhoods, it's easy for people to get around. But if we sort of follow the trend that I feel we're going down, is building suburbia and just building out now, that increases people's reliability on cars. So it's looking at other places, what other places are doing. So like in America and Australia, because they have big, massive suburbanization issues, not necessarily as big as we do, but we are following that kind of trend, I feel, at the moment.
So what supports, if you're looking to create more dense, compact neighbourhoods, because that means that people can get around by bike, by foot, in a wheelchair, with any mobility aid, assuming that we're doing what we all believe we should do, which is designing that inclusivity from the beginning and make sure that that's accessible to all. What does a high density compact neighbourhood look like from a planning perspective? What are you trying to get in the mix?
It has to be appropriate for each place, because obviously we're not about to build skyscrapers in the countryside. That just won't work. And we're not about to build houses in the middle of nowhere. It's making it appropriate to the place that it is, the context that it's within. But generally, in terms of healthier places, the higher the density, the better. But it's also about mix of uses. So it's all well and good delivering houses in high density, but that's no good if there aren't services and amenities close by, because that will encourage people to not walk and cycle to different places. But in terms of what that actually looks like, I think there isn't a go-to model to say, hey, that is what we want, a high density mixed place. It's having those aspects that are important, but adapting it to make sure it fits in with the local context and community. Again, looking at examples and picking the bits that you think work best for you and what you think will integrate. We don't necessarily build bubbles. We want to build places that integrate with what's already there. Is important, which is another thing I think planning tends to do. From the developer's kind of side, it's kind of like, I want to deliver this site, I want to make this particular area great, but you need to look at the wider picture. What's around you?
So it's a very kind of deliberate, integrated, diverse design from the, well, I can't say from the beginning because we're not starting off generally with new towns as such. We're starting off with infrastructure that's currently there in place. And absolutely that in terms of our approach at GM Moving, you know, we don't talk about blueprints, we don't talk about scaling up, we don't talk about, you know, taking one thing and then just imposing it somewhere else. It's very much recognizing that you can find these common ingredients and conditions that work, but it's then for people within a place to decide actually what meets their needs and their aspirations, which goes back to your point at the beginning, Ray, doesn't it, about, again, how do you make sure you've got that diversity of stakeholders around the table to say, let's co-design this ourselves together for this place and make it appropriate, so you don't have skyscrapers in the countryside. It's designing the right things in the right places to meet the needs of local people. So given, you know, coming to an end, I've heard lots of stories over the last few weeks of people saying that their habits have changed. So, you know, for some, it's very challenging to be inside and to be pushed into a small box, and particularly if it's an overcrowded box, you don't have a garden, you don't have access within 5 minutes to green space. But I've also, on a positive, heard people talking very much around, you know, their joy of doing their daily exercise, of them getting to the habit of doing a daily walk in a way that they didn't used to, or a daily ride or a daily run. And again, a different array of people. So, you know, we talk a lot about our age-friendly agenda in Greater Manchester, and I've heard older people saying that it's become a habit for them in the way it wasn't before, because it feels like safer actually for them to be on the streets than it was. Lots of comments around obviously the blossom and the blue sky, which we have no control over, but also about the sound of birds. It does, it definitely. Lots of people talking about birds, lots of recordings of bird song that people said they don't normally hear. So it has, you know, I think reminded people of how different things can feel, and that has encouraged certainly some people to be more active and more active locally than they would do normally when they may have previously got in a car and felt they had to drive out to the countryside.
Definitely.
So what do we do with that? So we've got these stories and these ambitions and this reimagining of what comes next. Have you got a sense of how we carry that forward?
I guess it's building on the momentum and making sure that we don't forget it is that key, that we can't go back to business as usual. Although this is a crisis, it's also an opportunity to make the changes that are necessary to make sure that we are healthier and happier. And it gives us a lot of time to self-reflect as well, which is key. And we haven't mentioned about mental health, but that's obviously physical and mental health go hand in hand and should be looked at separately. But yeah, I mean, even like our neighbours, since got to know them a lot better, which is great, and that encouraged that sense of community as well. And people across the street, if you think about clapping every Thursday, get out of the house and meeting neighbours that you might not have previously known. We're quite lucky, we're quite near the sea, so although we moved in last year, we said, oh yeah, we'd be down at the beach all the time. Didn't necessarily do that, but now we're trying to get down and walk there not every day, but as much as we can. We'd like to do the beach more, obviously, but can't really do that. So yeah, I think it's key that we can't forget this, and I'm sure we won't forget what's happened at all.
Yeah, but remembering the things we want to take forward as well as the things that we definitely want to leave behind us.
Exactly.
In all of that. So on a more personal note then, how do you like to move? So you said you like to walk to the beach, and what's changed for you in terms of your habits around staying active before COVID and now?
So I'm a keen swimmer, which has been really hard because obviously swimming pools have been shut, and I'm not brave enough yet to try sea swimming because it's a bit too cold, I think. But yeah, definitely walking a lot more. I think walking is, going back to what we were talking about previously, I think walking is such a easily accessible form of physical activity. Not for everyone, because obviously if the elderly and disabled, it's a lot harder for them. But generally, I think walking is a great means of improving your physical activity. So yeah, walking a lot more. We have one bike between me and my partner, so it's I wish we could go on cycle rides together, but we can't. So I guess we could go on cycle rides individually, but yeah, I haven't done that just yet. But
Sounds like you need another bike.
You do need to buy another bike. Yeah.
Well, thank you very much for your time. I really enjoyed
That's all right.
listening. Lots of food for thought, and
Great.
it'd be good to see what happens over the next few weeks and how we can intentionally design in spaces that more people can get around in whatever way they wish to, really, and those healthy livable neighbourhoods.
Definitely.
So enjoy the sunshine, enjoy
and
the
you, yes, thank
and
you.
catch up with you again soon.
Yeah, thanks, Eve.
Thanks, Tim. And to anyone listening who's interested in continuing this conversation, we will be hosting a Zoom session on Wednesday the 3rd of June from 11 to 12:30 to really think about how we build back better together in Greater Manchester, creating active, healthy places where communities can thrive. So please do join the conversation. Get in touch with me at eve@gmmoving.co.uk. Look forward to seeing you soon.
If you've enjoyed this podcast, why not share it or tell a friend about it? And if you've got feedback or ideas for future episodes, please get in touch with our team at Greater Sport using the links that you'll find on our podcast page.